Yeah, there definitely are clients where you do everything you can, and you do use prolotherapy, and you're still not better. So I always, because you got to realize, I mean, there are probably 1 in every 8 customers or so that comes to see me, has seen another prolotherapist. So in other words, all I'm going to say on this video, on this little interview, is what I would normally do if a customer came in. So one is I would make sure that when they were getting their previous prolotherapy that it was comprehensive prolotherapy, because yeah, one shot of PRP is prolotherapy, but it's not comprehensive. So normally, the normal reason why prolotherapy didn't work for them is it wasn't comprehensive enough. Like, in other words, the MRI did show like a degenerated disc, so they just treated that area. Or it showed a meniscal tear, and the doctor just treated the meniscus tear. Or they had an ultrasound, and it showed, one rotator cuff tendon that was injured. So they just got like 1 or 2 injections versus treating the whole joint for the joint instability. So in that sense, then they got prolotherapy, but I wouldn't say prolotherapy failed. It's just it wasn't comprehensive enough. So that's the first thing, was the prolotherapy comprehensive? Second is, did they use strong proliferants? Because some people go to a doctor and all they have as their proliferant is PRP. Or all they have as their proliferant is dextrose. So if they didn't try other solutions, then obviously I'd say, I'd make sure they're a good prolotherapy candidate, and then I might suggest, well, you didn't respond to this proliferant, but we're going to give you a different proliferant. So why one person needs this proliferant, another person needs that proliferant, sometimes you just don't know. I mean, obviously with clinical experience, because I've been doing this for 20 years, certain things respond to dextrose, certain things respond to bone marrow, certain things respond to PRP, certain things respond to sodium moreuate. So you get, with experience. So first thing is, did you get comprehensive prolotherapy? Second, did they use really, really strong proliferants? Third thing is, have you been doing anything that's inhibiting the healing? And there's so many things that inhibit the healing that people don't know about. I'll give you an example. It's pretty common for us to see folks that have seen other people, and they're still manipulating themselves. Like, in other words, they got neck pain, and while they're getting prolotherapy, they're manipulating themselves, or they're getting high velocity manipulation. So you're trying to regenerate ligaments, and then they're doing all kinds of things that tear the ligaments or loosen the ligaments. Also, somebody could have a job, like you're treating their elbow, and their elbow's killing them all day during their job. Well, you're not going to make too much progress with prolotherapy if what you're doing every day is causing a lot of pain. The pain's saying, hey, there's too much stress on this joint. Like, you need some motion to help you with prolotherapy to get better, but if you do too much, and some people it could be sitting, like a lot of us sit to do our computer work. Well, if you got back pain and it's killing you sitting, then guess what? You got to stand. You got to have a computer system set up where you're standing, because the guidelines with prolotherapy is you get prolotherapy, and after prolotherapy you don't do anything that causes sharp pain. So if your job, like you're a taxi cab driver and your knee's killing you while you're driving your taxi, you're injuring yourself. So don't do anything that causes sharp pain. 2 is any activity that you do, like exercise or activity, once you stop the activity, the extra pain from the activity should go away within 2 hours. So some people, especially athletes, they're just doing too much. Like they're getting prolotherapy, but then they're breaking down so much tissue because they're still playing basketball, or they're doing the activity and they're able to do the activity because they take anti-inflammatories. So of course the prolotherapy is not going to work because you're doing the activity, which you shouldn't be doing. You could do other activities like swimming or elliptical, but you shouldn't be running. Or 2 is you're taking anti-inflammatories. So 1 is comprehensive prolo, 2 is it's strong proliferants, 3 is there somebody doing something that's hurting the healing. So normally if you address all those things, the person will get better. 4th thing is the person isn't doing any of those things, but they're not healthy enough. So there are times, like if somebody's massively overweight, that I have to help them with weight loss, or they have to get on some program to lose weight. That is part of the program, or we have to get them on natural hormone replacement, like their healing ability is compromised. And there's lots of things that could cause that: bad marriage, eating crappy, not getting sleep, worrying about the economy. All these things play a factor in healing. All prolotherapy can do is trigger the person's body to heal it, but they still heal it. So if somebody's really, really healthy, they're gonna heal quicker. So say somebody comes and they look like they're very, very unhealthy. They've seen another prolotherapy doctor. They're still smoking. They don't have a healthy lifestyle. Then I'll tell them, part of you getting better, if you really want to get over this back pain, knee pain, ankle pain, you have to get a healthy lifestyle. Otherwise, you are going to get a bunch of surgical procedures. And it's the person's choice. If they want to get surgical procedures, they have an option for that. If they just want to take Vicodins or take anti-inflammatories. I should mention also Vicodins or narcotics suppress the immune system. So when you're getting prolotherapy, ideally no narcotics and then no anti-inflammatories. So let's just say theoretically somebody comes in, none of these things apply, and it really, really does look like the prolotherapy didn't work. Then more often than not, the person has an autonomic nervous system problem. Like in other words, the part of the body that tells you you have pain is primarily your autonomic nervous system. So then we'll do treatments. There's tests called the Axon 2 that they can get. So I might order an Axon 2 nerve pain test, which that would test for autonomic nervous system problems. So to see if they have an autonomic nervous system problem. Then if they do have an autonomic nervous system problem, it will tell us the level. So then we might then just do prolotherapy at that level, or we'll do other therapies, at that level, which there's a lot of them, including laser and other things, or I'll get them on medicines, that help the autonomic nervous system function better.